Greetings. Hope all is well for you today. I am Tammy Lee Demler. I'm your pharmacist here at Buffalo Psychiatric Center. And you have seen my presentations before, so I'm hoping that you're liking them. And you know that your pharmacist, another pharmacist, will be coming up and doing activities with you today to help make sure that you've learned everything that you need to. And today we're going to talk about inhalers. Most of us, if not everybody, has used an inhaler in the past. We're going to talk about different kinds of inhalers and why they're used. And hopefully when we have our learning activity today, you'll be able to ask more questions about these. So we get started at the same principle every single time we get together, and there are a few things we'll talk about today. Number one, why are oral inhalers used? So in the past, we've talked about nasal sprays or nasal inhalers. This is oral inhalers. Why are they used? What kind of medication is available in an oral inhaler? How do I use different types of inhalers? And what other things do I need to know? Sometimes I have an extra slide if we have a little extra time to talk about things, what you need to know, and it's somewhat the same no matter what kind of medication you're using. So I'm hoping that we can get to that today. So why an oral inhaler? Can anybody guess? Maybe you can talk amongst yourselves for a minute or two. Why would you use an oral inhaler? Well, I can give you a little bit of an insight there. It helps to increase the absorption of the medication into the lungs where the purpose is intended. So if you have something that is, if your lungs are inflamed, taking something by mouth may not work as quickly or as well as something that you inhale right into your lungs. It avoids unnecessary absorption into your bloodstream. So if you take a medication by mouth, let's say maybe a steroid, if you're having some asthma or swelling in your lungs from whatever reason, if you take a medicine by mouth, that goes everywhere in your body, and it will get to the lungs, but it also gets to other organs and other areas where it's not needed. So that can cause side effects sometimes that are unnecessary if the inhaled inhaler is good enough. So when you sometimes have an illness that is um, very severe, or it's gotten past when an inhaler alone wouldn't be enough, you can take an oral medication, and the best example is a steroid, so something like prednisone. So, but you know prednisone has side effects, and so if we can give it to you as an inhaler, then you have less side effects that you would see if you took it by mouth. So that would be one reason to use an inhaler. Some inhalers are used to treat lung disease or breathing problems, so you have a number of issues there. But some inhalers can be used to treat other conditions. We'll talk about some of them because they're very interesting. But you can't use those inhalers in people who have lung diseases or problems. So that doesn't make a lot of sense, right? But let's talk through that again. So some inhalers are intended to treat illness or disease in the lungs. Okay? Other inhalers are used as a way of getting medication into the body, into the system, into the lungs, or through the lungs to treat the body, but they can't be used in somebody that has a lung disease because it can compromise the way that they may be breathing. So that is kind of confusing, but I'll try to make it a little bit clearer as we go. So what kind of conditions do inhalers treat? I've got a number of things here. Inhaled medications most commonly treat asthma and COPD. COPD is that chronic obstructive pulmonary disease that frequently happens when people have smoked cigarettes for a long time. Not the only reason to have COPD, but it's a common one. Providers sometimes prescribe them to treat respiratory infections like bronchitis too. So if you have an infection, you might be getting an antibiotic and you need to just open up those airways, so you might be using an inhaler to help that. But there are other things that can be used, and we don't use them so much here in the hospital, but you might see it out in a different type of hospital. Cystic fibrosis, I'm not going to get into that too much because that's an inherited genetic disease. It's not something that you just acquire over time. So, and I don't know of anybody in our hospital that has that illness right now, so we're not going to waste your time on that. Diabetes, there is inhaled insulin now that can, well, you can use injectable insulin. That's typically what we do. You can use insulin pens, there are pumps, but now there's rapid acting inhaled insulin. We don't use it very much here because many people in our hospital have lung disease that prevents us being able to use that. There's other reasons that prescribers may prefer inhaled or injected insulin instead if it's a little bit easier to control. But for people on the outside, in the community, outside of a hospital, that may be a preferred way of doing it. But just know that that's kind of an interesting thing. Again, we're not treating a disease in the lungs. We're using the lungs to help treat a disease. Isn't that interesting? It helps to inhale that medication so it does work in the body. We also have here an example of the flu. We all know about the flu, just the regular garden variety flu. We're not talking about COVID. There is a thing called Relenza. It's an inhaler, and it can be used for diminishing or decreasing the severity of the flu illness. However, it needs to be started really early on, and it can't be used in people who have any compromise to their lungs. And again, most, if not everybody, probably in this hospital has a little bit of a lung compromise, maybe whether it be due to smoking or other illness. You may be perfectly healthy and your lungs may be perfectly fine, but we don't just generally use this medication for that purpose. If you have the flu and it's caught early, we have things like Tamiflu, or if you have COVID, we can prescribe something called Paxlovid that helps to diminish the flu severity, different types of flu. But it's interesting because this is an inhaler that's used into the lungs to help treat or reduce the severity of illness for flu. There's also some other illnesses that can be used, and here you're seeing maybe schizophrenia. There is an inhaled loxapine that is available, but it's been found to trigger people's asthma and COPD because you're inhaling almost what would be considered a dry powder. So that almost makes me feel like I want to cough just thinking about it. But in some cases, it's a better alternative for some people to taking an oral medicine or even injectable. And Parkinson's too, they're coming up with new items, new medications to help with that illness as well. So just interesting conversation. I did a little research on this topic so that I could give you the most updated information, and I thought that was kind of interesting. So here, this is probably one of the more common type of medications that you might see, bronchodilator. It's to open up your airways if they become constricted. People who have asthma or COPD can have constriction in their lungs, but if you have a viral illness or if you're just getting over something like pneumonia, you can have constriction because the bronchial tubes in your lungs are inflamed, and when your lungs are inflamed, they can be constrictive, and it can cause you to cough, to feel tight in the chest, and the bronchodilators just open you up, and it helps you breathe a little bit better. And you may, if you've used a bronchodilator, you may have remembered that it might make you feel a little jittery, almost like too much coffee, too jittery. My heart starts to race a little bit. That's a side effect of a medication that would be expected. So again, we don't want to overuse bronchodilators. And when you're on a bronchodilator, there's a certain amount of puffs per day you should be limiting yourself to. So if you're finding that you're on one and you're needing more and more and more, you never take more than what your doctor's prescribed. But if you find that you're needing it more often, then you'll need to let someone know, because you may need something done by mouth to reduce that inflammation. Overuse of bronchodilators is not healthy. Steroids help to decrease inflammation. You can inhale a steroid, you can take one by mouth. Sometimes we do both. So we want a little bit of that coating to be in the lungs so that you have that acting right on the tissue, and then taking an oral medication as well to just give it a little kick, a little extra boost. And then antihistamines to reduce allergic symptoms. They do have these available also in oral inhaler, and sometimes we use these as a combination, so you may be on more than one. There are really three general types of oral inhalers. Metered dose inhalers have been around the longest. Dry powder inhalers come in probably at the second level of history, and then now there's a soft mist. So one of the three would be what you would generally be getting. Metered dose inhalers, there's a lot of examples here I gave you. You may recognize one more or the other, but I would say the most common one that I would say would be probably the Proventil or Advair or Ventolin. Those are some of the more common ones that we see. And you have to shake them before you use them. There is a certain amount of doses in each inhaler, so they're metered, meaning that there's a measured amount that you get, so you don't have to worry about one of the puffs being too much or too little. You just have to make sure that you're inhaling them properly, and we'll show you technique in just a few minutes. So this is what it's going to look like. You'll ultimately see a video depiction of this meter dose inhaler, but I'm going to walk you through it. I think that sometimes is helpful to be able to see pictures and then watch the whole thing come together. This is what it looks like. If I could go back a slide, you would see there was a cap on the end that keeps the mouthpiece clean. You have to remove that cap and then inhale your medication. And keeping these inhalers clean and free of dust, dirt, and germs as best you can is really important because you're inhaling it into your lungs. So you can see here you've got to open your teeth, kind of clench your teeth down around it, not real hard, but just to get them out of the way. And you're going to need to make sure you're following instructions. So there's the mouthpiece, and you need to remove the mouthpiece. I usually, and I've used inhalers, I usually try to clean the mouthpiece every single time I use it with just a little bit of alcohol. And inside it, the medication is a canister, so you can see how that lifts out and in. When you're washing the outside canister, the outside housing of the inhaler, that's where you would take out the medication, rinse out the inhaler plastic housing device, and keep it nice and clean and dry. You want to make sure that it's dried nicely so that there's no chance of mold growth there. You're going to want to shake it well. I would not say shake everything unless you check with the pharmacist. I don't recall any of the inhalers being a problem if you shake them, and they're not meant to be shaken, but generally we'll put a shake well sticker. Ask when you're picking it up. If you've already picked it up, ask your pharmacist if you should be shaking it. We're always there. You can always call, and I encourage you to do that. Never guess. It's never a good thing to guess if you don't know. And when you push down the canister, like you can see this finger here, this is one way to do it. Sometimes it's tough to be able to squeeze between two fingers. It's a little awkward. You can use more than one finger on top, and you can hold it with the other. But it's best to make sure you have a really good handle on it, that it's really nicely, firmly gripped, and push down, and that'll be one puff of medicine. It's best to be standing up or to be seated with a really nice posture so that you can breathe nice and deeply into your lungs. You wouldn't want to be doing this when you're laying in bed, for example. You're going to want to breathe in deeply, and then you're going to exhale to fully empty your lungs, because the next time you inhale, you're going to be putting that inhaler into your mouth. So a nice, fresh, deep, nice, slow breath with the lips around the mouthpiece. Make a nice tight seal, and you're going to just push that down for one puff. Inhale, and you can see kind of the particles going back there. In the video, it'll be more clear, but you're going to want to just push down once, inhale, nice and slow. With this particular one, it's a nice and slow, deep breath, and you're going to be holding your breath as a few seconds at least, as long as you possibly can. And that is one puff. Sometimes we need more than one puff, so you would have to repeat that, obviously. It is recommended to have a pause in between puffs if you can, so that you let that first dose really start to work. And there is an example of the path to which inhaler you use first. So if you have two different types of inhalers, you're going to want to make sure you'd have them labeled 1 and 2, because if you do it the opposite, it won't work as well for you. They suggest that you hold your breath for 10 seconds. That can be a long time, especially if you're feeling sick. You may want to feel like you're going to cough. Just do your best. 10 is ideal, but I've been in situations where I've had to cough through it because I just can't hold my breath that long when I'm not feeling well. So the next puff, the second time, if you were to do 2, you're probably going to hold your breath a little longer because that medicine will have started to work by then. And then step 9 here, they've got them labeled. Get ready for another puff. Wait a few minutes in between doses. As I mentioned before, if you take the first puff and you cough a little bit through it, waiting a few minutes for that medicine to work and then doing another puff after, if you're prescribed 2 puffs, will be easier the next time around. I recommend that you rinse your mouth regardless of the kind of inhaler you're using. It'll get you into a good practice for inhalers that require the rinsing. An example of an inhaler that requires the rinsing is a steroid inhaler. Sometimes there can be a combination of ingredients, and one of them is a steroid. If you don't rinse your mouth out and you spit it out, rinse and spit, it can cause thrush growth on your tongue, which is a little bit of a yeast coating, and it can itch and it can burn, and it's harder to get rid of than it is to prevent it. So I would recommend that you do that. If you've ever seen a little baby with white coating on the tongue, sometimes they can get thrush. Little babies can get thrush even, so better to try to prevent that.
This animation is brought to you by the Nucleus Medical Art Library, or NMAL, where you can download this animation and thousands of medical images and videos created by Nucleus Medical Media. To apply for a free 30-day trial, click on the link in the description.
People who have lung conditions like asthma or COPD often take their medications using a handheld device called a metered dose inhaler, or MDI. A metered dose inhaler sprays medicine through your mouth so that it can reach your airways. If your inhaler is not used the right way, some medicine may not enter your mouth, or some may remain in the back of your mouth. Either way, it may not reach your airways where it is needed. This video will show you the general steps for using an inhaler correctly. It's important to follow the instructions that came with your metered dose inhaler. A metered dose inhaler has three main parts: the mouthpiece cover, the plastic sleeve with a mouthpiece, and the medicine container. Before using your metered dose inhaler, remove the mouthpiece cap and shake the inhaler. If this is the first time you are using your inhaler, or if you haven't used it in a while, you may need to prime it. Check the instructions for how and when to do this with your inhaler, as they can differ depending on the type of inhaler and medicine. When you're ready to use your inhaler, stand or sit up straight. Breathe in deeply and breathe out completely to empty your lungs. After shaking the inhaler, put the mouthpiece in your mouth and close your lips around it to form a tight seal. As you breathe in through your mouth, press down firmly on the top of your inhaler to release one puff of medicine. Keep breathing in slowly through your mouth for 3 to 5 seconds until your lungs are completely full. It is recommended to hold your breath for approximately 10 counts. Finally, breathe out slowly through your mouth. If your medicine dose requires 2 puffs, you may need to wait before taking the second puff. Follow the instructions that came with your inhaler to know how long to wait between puffs. After using a steroid inhaler, rinse out your mouth with water and spit it out. It's important to keep your inhaler clean so that it works properly. Check your inhaler's instructions for the right way to clean it. Proper use of your metered dose inhaler may help you control the symptoms of your lung condition. If you have questions about the use of your inhaler, talk to your healthcare provider or pharmacist. Ask them to watch you use your inhaler to see if you are using it properly.
That was a great tip, to be able to ask somebody to watch you using it. Then we can help advise as to what would make your technique more effective, or maybe you're doing it perfectly fine. So let's talk about dry powder inhalers now. Dry powder inhalers contain medicine in the form of a dry powder. There's no propellant, and there's no additional component that makes that medication be absorbed into the body. I meant to say back with the metered dose inhaler, there were propellants, but they are safe for human use to have them in the body, whereas a propellant for hairspray, for example, is not meant for human in-body use, right? That's external only. But these propellants help to have the medication go where it needs to go. Dry powder inhaler, not so much. It's just a dry powder. Some people can't tolerate these because of the feeling of the dry powder, and because there's traces of lactose, which is that sugar that's found in milk, that people can have allergies to, and they can't tolerate it. So we would need to find another alternative for people who they prefer that. So Advair discus, Ceravent discus, these are examples. Brio ellipta. My mom actually uses one of these, and she does real fine with it, but not everybody does. But let's take a look at these. Advair discus is what we use here in the hospital, so I chose to find this for you. If you've used this, you'll see a familiar medication. There will be a video, I think, to show you this also, but I wanted to walk through it. If I didn't put the video in here, I don't think you'll lose out on anything. But you're going to want to open the discus. Usually your nurse would help you with this. If you're at home, you'd be doing it yourself, but you'd be trained. It does count the metered doses. So as far as the other inhalers, there are kind of this ill-advised float test that I would not recommend. If floating, seeing it at floats or sinks might be a technique that some may use, but my suggestion is to figure out how many times a day you're using it and about how many puffs are in an inhaler, and then let your pharmacist calculate when you need to get a new one. It's always best to have a backup just in case for whatever reason it becomes jammed or not function properly. So I always suggest having a backup inhaler anyways. So this is what he's doing now. He's sliding the lever. There's a little lever on there. It goes snap. It sounds like a little bit of a snap. You're going to want to breathe out, and you're going to want to seal the lips around the mouthpiece when you come back up to it. And you're going to actually breathe in quickly and deeply. It's different than the inhaler that's slow and steady. This is a really nice, quick inhalation to get all that powder into the lungs. And you hold the breath. And again, they're saying 10 counts. 5 is great. 10 is better, but we'll do whatever you can. Then you're going to breathe out, and then you're going to repeat it if you're going to need another dose, which many times with Advair you do, but make sure you know your dose and what your doctor's prescribed. And then you'll want to rinse out your mouth. This is the example, so video included.
Slide open the discus. Slide the lever over until you hear a click. Breathe out, away from the discus. Seal your lips around the mouthpiece and breathe in quickly and deeply. Remove the discus from your mouth and hold your breath for 5 to 10 seconds. Breathe out. Close the discus and repeat these steps if required. Then rinse your mouth with water.
So it was important, again, they described cleaning, rinsing. When they said rinse your mouth, though, they didn't describe if you spit or swallow, always spit, because you don't want to swallow that steroid into your esophagus, because that could increase the risk of that thrush. And if you've had thrush, you'll never want it again. It's really uncomfortable. So there's the last type here is the soft mist inhaler. We're going to look at this. Soft mist inhalers are the newest of the kids on the block, so to speak. They have a medication in a liquid form. The liquid becomes a fine mist that's inhaled by a compressed spring in the inhaler. So it's a liquid. The mechanism of the inhaler itself aerosolizes it, and it becomes a nice soft mist. I think it's probably more comfortable than inhaling a dry powder, but they don't contain a propellant, but they do need some coordination. So you want to make sure that the maximum amount of the medication reaches your lungs and not get stuck.
How to use a Respimat soft mist inhaler. Check the dose counter. Do not use if the dose counter says 0. 0 means the cartridge is empty and needs to be replaced. Put new inhaler together. Push clear safety latch and take off clear base. Push metal cartridge into device by pushing it down onto a flat hard surface. Write down start date on side of inhaler. Put clear base back on inhaler. Prime inhaler by turning the clear base to the right, opening the cap, and pressing the button. Do this 3 times or until you see a mist come out of the mouthpiece. You do not need to prime this inhaler again. Prepare your body by sitting or standing up straight. Breathe out all the way, away from the inhaler. Never breathe into the device. Tilt your head back slightly. Put the mouthpiece into your mouth, between your teeth. Close your lips tightly around the mouthpiece without covering the air vents. Start taking a deep and steady breath in as you push the button. Remove the inhaler from your mouth and hold your breath for up to 10 seconds. Breathe out slowly, close cap. Repeat steps, turn, open, press, if you need to take another puff. Rinse your mouth with water and spit it out. Close inhaler cover and store in a cool, dry place. If you have trouble using the inhaler correctly, ask your pharmacist or doctor for help.
Okay, so hopefully that was a good demonstration, and maybe you can relate to what that all feels like and the need for that, having that perfect timing, so to speak. There are opportunities to kind of walk through the stages and steps without actually inhaling medication, so you can kind of time it and do sort of a role play kind of thing. If you're in your group today with your pharmacist, you can have them show you. But let's get on to the rest of this. So what's the difference between an inhaler and a nebulizer? Don't forget that an inhaler you walk with, you can move around with it. A nebulizer is a machine. It's not handheld. It's you have to plug it in. It's a slow mist that's generated, but it can actually really get to it can get to your lungs a lot more efficiently. So a nebulizer can be used when you're really sick and you're in a doctor's office. Nebulizers are large and they use a battery, whereas an inhaler you can walk around. They're more mobile. They're easier to move around, and it doesn't need any electricity. So other things that you need to know, we always like to do this before we do our Q&A, is how to keep it clean. Follow specific instructions provided to you. If you weren't provided with specific instructions, make sure you call. Don't take things apart without looking to make sure you're doing it properly, because it would be a shame to have something be broken or dislodged in a way that might be harmful to you. Only use it as prescribed. I know sometimes it feels as though, if one is good, two is better. Don't assume that taking more on your own would be the right thing to do. Doctor needs to prescribe in a different way if the current prescription isn't working for you, and taking too much may be dangerous. So only as prescribed for only as long as it's prescribed. Sometimes, as I said before, you may be getting an inhaler that a friend uses all the time because they have asthma, but you're only using it for this particular illness. Maybe you have a cold or influenza or something where you need temporary intervention. Don't continue using it beyond the prescribed dose or beyond the prescribed duration of time that your doctor prescribed it for. And if unclear, ask your pharmacist. And if the pharmacist doesn't know, we'll call your doctor. So we're all a team, and we want to make sure what's best for you is best for you. Make sure you rinse your mouth out after using an inhaler that's a steroid. If you don't know, rinse anyways. Not that they all taste bad, but they all have some sort of taste. I always like to just rinse and spit, get it right out. Some inhalers have a dose counter, others don't, but again, I wouldn't get into the letting something float in water. That used to be the only way the pharmacist might have been able to tell if something was full or empty, but now that's not the way we do it. So generally, it's best to just sort of mathematically anticipate when you would need it, again, and then have a backup always. Some inhalers expire after a certain number of weeks after you've taken it out of the pouch. So there's a seal, exposure to air and light. Make that medication have a timed expiration. So just make sure that you're looking at the details of expiration so that you're not using it past the time where it's good. Some inhalers are used every day whether you feel you need it or not. So again, some are used by trigger of symptom. You tight chest, use your inhaler. Others are used regularly on a scheduled basis, and if you're having shortness of breath in between those doses, there may be a rescue inhaler is what they call it, or a short-acting inhaler. Make sure you inquire. Don't try to add more doses of that one prescription that you're using on a scheduled basis. Here we have the rescue inhaler. Never exceed your prescribed dose ever. Sometimes patients who feel that they're really comfortable with these inhalers can add a few doses. You really shouldn't do that. As I said, overuse can be a problem and can be serious, so we don't want to have you overuse your inhaler. And if all of a sudden you're needing more inhaler, that could mean that you have something else going on that we would need to evaluate. So maybe you have a little infection, maybe your breathing situation or your baseline breathing problem has gotten worse for some reason, and we need to just intervene and help correct that. Again, if any kind of breathing problems worsen or they don't improve, you need to let your doctor know. And always, always get emergency medical care if you see that you're having any sign of serious allergic reaction, or all of a sudden your medications that used to work don't work. A call to emergency services may save a life, and we want to make sure that you're safe. So if you are with someone who needs an inhaler and they can't find relief from it, nor can you, it's always best to get emergency help. Store your inhaler at room temperature. Do not allow it to freeze or become excessively heated. Here in Buffalo, New York, we all know we have extreme everything, right? Cold and heat. So I would say don't keep your inhaler in your car. Make sure it's on your person. If you don't carry a purse, maybe have just a habit of sticking, your medication in your pocket, that even though it's close to your body, it won't become excessively warm as it would in a car in a 90-degree day. If you miss a scheduled dose, try to determine how long it was since you missed it. Sometimes it's best to just skip the dose and then take your next dose at your usual time. Don't take 2 doses at a time to catch up. If you're sort of unsure about dosing and make up times, call your pharmacist. We can help you. Do not share your inhaler and do not borrow from other people. Inhalers, even with the same brand name, come in different doses and are prescribed differently for people, and they need to be specific for the person for whom they're intended. Now we're going to do our quiz. Hopefully you love this part. Are you ready? Which of the following is not a medication inhaler? Not a metered dose inhaler, dry powdered inhaler, a soft mist inhaler, or an e-cigarette vaping inhaler? Hopefully you know that one is an e-cigarette vaping inhaler. All the other 3 are inhalers, and we just talked about them. Okay, next question. Are you ready? What is an example of an illness that can be treated with an inhaler? A skin infection, hypertension, asthma, or high cholesterol? I mentioned a number of different types of disease states that can be treated through an inhaler, but none of them were, other than asthma, correct. So hopefully you got that right. And then how do I tell when my inhaler needs to be replaced or refilled? It sinks to the bottom of a tank filled with water. There is no sound when you shake it. The dose counter says it's empty, or it's over a year old. Which of those do you like to be able to know that you need a replacement? The dose counter says it's empty. Now, if it's over a year old, probably would need replacement anyways, but that's not the right answer for this scenario, because this C is better. Shaking it and sound is not a very reliable method either, because some make no sound. And we don't want to do the sink full of water and the tank floating or sinking. That really is not reliable on a patient perspective level. I'd rather have you use the dose counter. True or false? All inhalers should be used only when you're having symptoms of illness. All inhalers should only be used when you're having symptoms of illness. True or false? It is false, because sometimes people take medications that are inhalers to keep their disease state under control. So they're not having symptoms. They're not having an exacerbation of symptoms. They're under control. They're being treated, and it's working. So they may not have symptoms. They may be doing just fine. How about true or false with this one? Inhalers can be used by anyone who can inhale air. Is that true or false? I would say false, because sometimes you can inhale air. Obviously, if you're a living human being, you breathe air, but you might have illnesses that affect your lung, may affect your lung integrity. So COPD, asthma, people who have those types of illnesses can't use some inhalers to treat other diseases. And how about true or false? Inhalers should be placed in the dishwasher to clean them properly. Not true. Actually, dishwashers can melt plastic, and it's not recommended. Just a nice clean cloth left out to dry. Again, following instructions for your specific inhaler is really important. And with that, I want to thank you for your time. Your pharmacist will be here very soon to do something super fun, and I hope you have a great day. We'll see you next time. Take care. Be well.